also wanted to give you an update on the social services budget. Dave Litvack, Representative Litvack, and I are on that committee, Health and Human Services Appropriations, and we had some. It was kind of like chess this morning. I don't know if you were there, but it was very interesting. We have some huge needs in our communities, and how we fund respite care, how we fund people with disabilities, and some of the great needs that they have, domestic violence, mental health, and substance abuse. A lot of those are on the chopping block. And Representative Litvack and I made some motions this morning. There were other people that made motions to kind of change the order of some things, but we basically passed out, made a motion to pass out and to fund, take them off the list, the chopping block list, that a lot of those would be funded. So maybe Representative Litvack can give us more insight into that.
Well, really under the leadership of Senator Jones, this morning in the Social Service Appropriations Subcommittee, we actually appropriated within our peer review $16 million to some of the hotspot lists. But what's an important message to understand is that that does not cover all the needs that are out there. And quite frankly, the word of the Social Services Appropriations Subcommittee will not be the final word on that. Today marks a critical step in the development of the budget for the state, moving on to executive appropriations. If anything, the message that was sent within the Social Services Appropriations Subcommittee that this being a priority area, not just for the Democrats and Republicans on that committee, is a critical message to be sent as we move forward. Who knows what happens with the motion that we made, ultimately in terms of whether it moves forward or not. But there was even, there's acknowledgement that these are critical areas in government services that are not going to be provided by anyone else if we're not doing it. So recognition of some of the drastic nature of the cuts.
And I think it was noteworthy that we had people from across the aisle also join in and recognize that we need to fund these services, and that was an important point to make.
Do you think as the budget goes on, though, these programs that you fought to save, they really stand a chance when they finally hit executive appropriations?
Well, I can tell you that Senator Jones and I do sit on executive appropriations, and from our perspective, we will fight very hard for that. And yeah, I do. I mean, if I look over the track record of the last 2 or 3 years during the tough economic times that we've had, the legislature actually has a pretty good track record of prioritizing some of these critical needs in the social services area, even a willingness to use one-time money for ongoing needs, recognizing that the critical nature. So I am pretty sure.
That's what you're going to be pushing for? Are there other little hotspots, things that didn't
there's
get funded?
absolutely.
What might be one of those?
I can tell you one that I've spoken to members in the House Democratic Caucus, Medicaid interpreters. So that is a cut that is still on there. DORA, something that both Senator Jones and I fought very hard for, is on the prioritization list, but still to be cut. And then there's building blocks. There's things that are mandatory, in essence, in terms of what we need to do around Medicaid and CHIP that haven't been funded yet. So we did some good things, but by no means did it go far enough in terms of what we had available to us as far as tools and some revenue. So there's a lot more to be done.
It was interesting in meeting with Palmer DePaulis, Human Services Department head, and the Department of Health head last night, and asking them what cuts can they live with. And the bottom line is we've cut so much over the last few years that there really is not a lot left. And so we're truly cutting into services now. That's what they're looking at on the chopping block.
One little clarification. Dora, you said it's on the prioritization list, but I was a little confused about finding what happened. So is that going to go?
I would say it's probably about midway towards the top in terms of where our